It staggers me every time I think about it, that such a common disease, a common condition, takes, in the UK, we think, on average, about 8 years, on average, for a person with endometriosis to have a definitive diagnosis. I think it's a structural failure not just of our health system, but also of our education system. Pain in a female body is quite normalised in our culture. So the degree to which discomfort is unacceptable is not always clear to people who experience it and also to doctors.
Can we begin by talking about how long it takes people to get from having a symptom to getting the diagnosis?
It staggers me every time I think about it, that such a common disease, a common condition, takes, in the UK, we think, on average, about 8 years, on average,
8 years.
for a person with endometriosis to have a definitive diagnosis.
I mean, that is almost comical. I mean, it's fully 10% of a long life.
Absolutely. I've interviewed and spoken to women who have had even longer diagnosis time. I came across one person who's had 25 years of consulting GPs and hospital clinicians before actually having a diagnosis that it was all attributable to endometriosis.
Chi, can you just talk to us a bit about that? 8 years is so atypical. You know, whether you've got a broken hip or cancer, people want to get a diagnosis in hours to days to weeks at most for most things. Why does it take so long with endometriosis?
Well, I think it's a structural failure not just of our health system, but also of our education system. Because in order to present to a GP, somebody needs to know that there's something wrong with their menstrual cycle. And if we look at how young women, people, girls learn about their menstrual cycle, it's not clear to a young person what is normal and what's abnormal. And so there's a huge boundary to even talking about it or going to a doctor to find out what's wrong.
So part of the delay is that people go, I am just expected to live with severe pain for a decent part of my cycle, for a decent part of my life.
Exactly that, Xand. So pain in a female body is quite normalised in our culture. So period pain is deemed normal. And, for example, there's pain during childbirth is considered normal. So the degree to which discomfort is unacceptable is not always clear to people who experience it and also to doctors who are consulting about it.
So let's go back to sort of medical school 101. Give us the basics. What is endometriosis? Because I'm still not sure I could completely do it.
Endometriosis, Chris, is a condition where cells very similar to the cells that line the womb grow outside of the womb. So they grow in the pelvic cavity on organs like the ovaries, around the uterus, and even on the bladder and bowel and the fallopian tubes. And those cells are very sensitive to hormones, the hormones released during the menstrual cycle. So in the early phase of the menstrual cycle, those cells can grow. And in the second stage of the menstrual cycle, they then degrade and there's inflammation. And that inflammation can cause pain and also scarring and damage to tissues around where those cells are in the abdomen. Those cells causing endometriosis are stem cells. Stem cells are cells that have the possibility to develop into all different types of body tissue. So they may not have actually originated in the lining of the uterus, but they may be stem cells that have then decided to develop into endometrial tissue.
Do a bit of the anatomy. How do these cells get from inside the uterus, which we know opens to the outside world through the cervix and then the vagina, how do the cells get from the uterus to inside the abdominal cavity?
Okay, so we don't actually know. There are theories, and some quite credible. It's clear that in people that have endometriosis and people that don't have endometriosis, those cells are found in the pelvis and abdomen.
Okay.
So it's not necessarily just that the cells are there, that's what causes endometriosis. So it's something around the environment that they land in and maybe the hormonal and the immune system makeup that means it then causes endometriosis and the cells proliferate and cause this inflammatory condition. But the way they get out is that the cells that line the womb, there's something called retrograde menstruation, so that the flow of blood, instead of going from the uterus, the womb, down through the cervix and out through the vagina, goes backwards, so up through the fallopian tubes that catch the eggs from the ovaries and out into the abdominal cavity and the pelvic cavity. There are other theories around, and we know that endometriosis exists not just in the pelvis and not just in the abdomen. It can be found in tissues all over the body. So the endometriosis cells and the disease can be found in the lungs, in muscles, in bone, in nerves and joints. It's even been found in the brain. And it's not possible that that could have come through retrograde or backwards flow of menstruation.
So several layers of uncertainty.
A third theory is that around the time of birth in female babies, sometimes when there's a flux of female hormones, there may be a type of menstruation in the infant uterus.
Is that maternal hormones?
Maternal hormones.
Yeah, maternal hormones.
That the baby is exposed to.
Right.
So some babies have a period just for a very short period of time because of the flux of hormones in the mother around birth. In most cases, that's not going to be bled out because the cervix is plugged very thickly and securely with mucus. And so it may then go internally, and that those stem cells may be seeded. And then during puberty, when the hormones in the child rise, then those cells become symptomatic with endometriosis.
But all of this is theoretical. These are exploratory ideas, and there may be other mechanisms at work, or it may be some of these, none of these, or all of these.
And we don't know because it's a disease that's so incredibly under-researched.
Tell us more about common symptoms and unusual symptoms.
The most common symptom is pain around the time of menstruation, and it can occur in other points of the period as well, of the menstrual cycle as well. And pain with endometriosis is not the nagging pain of a menstrual cramp, but it can be exceedingly severe. Some people have spent double with the pain. It can be so painful that it causes vomiting, and some people have described the pain as worse than the pain that they experienced during childbirth.
And is that because the pain of irritation and inflammation inside your peritoneal cavity is sort of famously, when you're learning medicine, just a terrible pain? It's a bit like appendicitis, where people have to be still. That's so sensitive in there. Is that part of why it's so painful?
It's highly likely, yes, because the nerve endings in the peritoneum, the lining of the abdominal and pelvic cavity, are different to the nerves in the uterus that cramps, and it's a different type, slightly different pain. And people describe the pain as like being stretched from the inside, or a stabbing-like pain, and very, very severe.
What about more unusual symptoms in terms of when you have uterine tissue distant from the uterus, the brain? You talked about nerves, lungs, bones. Do we understand anything about how those more unusual locations for the cells, how they relate to any symptoms?
Yes, so to answer both of those parts, so some of the areas close to the uterus can also cause symptoms when they have endometriosis growing on them. So the bladder, people can have pain on passing urine, and that's quite common with endometriosis and leads to misdiagnosis as urine infections, for example. And some people have what's thought to be recurrent urine infections, may be treated with antibiotics when actually it's endometriosis. And when endometriosis covers the bowel, it can cause pain on opening the bowels, and it can also cause irritable bowel type symptoms like bloating and diarrhea and constipation. And they're quite common in endometriosis because those areas are quite close to the uterus.
I just want to be really clear about the symptoms, because there'll be people listening going, hang on a minute, this could be me. It's a great mimic for other things because it affects different organs. So the timing with menstrual cycle is part of the diagnosis. What other things should people be looking for?
So because endometriosis can occur in tissues all over the body, as we said, and very unlikely will the dots be joined by clinicians, but certainly something that fluctuates with the hormonal cycle would lead one to think, could this be endometriosis? Typically, there are some much more broad symptoms that people experience. So a lot of people experience, as I said, bloating and discomfort in the second part of the cycle, and exhaustion because there's so much inflammation. And so fatigue, which may be put down as chronic fatigue, because it is a chronic disease and persistent, it may be more cyclical. And that is a very common symptom of endometriosis. Another symptom is heavy bleeding. And we don't know exactly why there's heavy bleeding in endometriosis, because endometriosis is found outside of the womb or the uterus, but it's debilitating and also so heavy that it causes anemia and low iron. And low iron itself causes a lot of symptoms like extreme fatigue, dizziness, anxiety, cognitive issues with concentration, brain fog, and it can even cause things like ADHD type symptoms. So these may all be in the mix.
For someone who's suspecting it, or doctors who maybe haven't had it front of mind, perhaps 1 in 10 of the women of reproductive age they're seeing, this is the problems. They've got to be looking for it. What is the test, the diagnostic process that you should be asking for if you think this is what's going on?
Thanks, Xand. So exactly that. 1 in 10 is not rare. It's about 1.5 million people in the UK. And that's probably an underestimate because very few people actually get diagnosed with endometriosis. So the pathways to diagnosis, for example, NICE guidelines, include, first of all, treating it in general practice. So giving treatments that might help manage the pain and heavy bleeding and the symptoms. So that in itself actually causes a delay of getting a definitive diagnosis. So things like the oral contraceptive pill may reduce symptoms and painkillers. But the disease isn't eradicated because it's a chronic disease. It's not cured by those. So there'll be a cadre of people who are never diagnosed, but their symptoms are just managed.
But they're not diagnosed with it formally.
So to get a formal diagnosis, the definitive test requires surgery. So having a laparoscopy, so that going through the abdominal wall, looking inside the abdominal cavity with a telescope, and actually visualizing those abnormal cells. So at the moment, we don't have a test for endometriosis that doesn't require an operation.
And how important is it for people with these debilitating symptoms to get that test? Like, once you've got the label of endometriosis, what does that do to your life and your care?
So it enables one to grade the endometriosis and determine how much there is and how severe it is. And currently there are different ways of classifying endometriosis, but one helpful one is that it's superficial, so just on the layer of the lining of the abdominal and pelvic cavity or around the pelvic organs, or ovarian endometriosis, where there can be growths on the ovaries causing cysts, which we sometimes call chocolate cysts because of the appearance.
The sort of the dried
blood,
not dried blood, but dead blood cells
exactly.
in the cyst.
Yes, which can rupture and can be exceedingly tender and painful. And that's another symptom that one can get with endometriosis is tenderness and pain when pressing the pelvic organs. So, for example, during having sex or after having sex. That's an important symptom of endometriosis. And the third classification is deep endometriosis, where it's not just on the surface of organs or tissues, but it's deep to them. It's penetrated deep inside. And so that may present in a slightly different way and it's more difficult to treat and manage. Sometimes can be less associated with pain. In some settings, people may have what's called a frozen pelvis. So the pelvis has got a large amount of endometriosis. It's deep and may even be less painful at that stage, but there's a lot of disease. And in that context, we may see things like more difficulty conceiving with problems with infertility. In the context of deep or very extensive endometriosis, when there's scarring where the endometriosis is, then the pain may not be just during the menstrual bleeding time, but it can be throughout the menstrual cycle because there's inflammation. And in fact, endometriosis could be termed an inflammatory condition, really. Interestingly, endometriosis, because it's a disease that derived from endometrial stem cells that have developed into endometrial cells, doesn't just occur in women and people with female biology, but it also can occur in men and people with male biology. So in that context, diagnosis is even more difficult, and it's incredibly rare, we suspect.
And once you've got a staging, a clear diagnosis, what does that allow in terms of treatment and management?
So it's good to talk about treatment, Xand. Once one's visualised endometriosis, then it may be clear whether surgery might be helpful to clear the abnormal tissue. And many people might go through one or a series of surgeries to clear out endometriosis because it can recur after surgery.
Are there drugs that we can use to modify symptoms?
So another arm of treatment is using drugs that modify the hormones during the menstrual cycle and can reduce that flux of growth and then shedding and degradation and inflammation of the tissues that cause endometriosis. So hormonal therapies are another very important aspect of treatment.
I think lots of listeners will now be going, well, this could be me. How can people advocate for themselves?
Great question, Xand. It comes back to the thing that I find so important about menstrual health, which is menstrual cycle awareness. So really knowing one's own cycle throughout the month. And also education around this from a young age so that young people can understand more about their menstrual cycle and be equipped to talk about it without embarrassment, without stigma, without shame. Then hopefully people listening now can hear how common this condition is and how underdiagnosed it is, and so therefore be more emboldened to actually speak to their doctors about it.
Chi, can you talk to us about resources? Like, where can people get more help?
There's a lot of resources online. Endometriosis UK is a really important resource of information and support. There are official pages on the NHS website about endometriosis, and there are a lot of other advocacy groups. And what I think is really important is that there is now a drive, really only in the last year, to include endometriosis in health education in schools.
That's incredibly helpful, Chi. It's such a pleasure to have you back on this podcast. We always ask our experts the same question at the end, how your research affects your life. We asked you that last time, but can you be more specific in this instance about how your knowledge about endometriosis affects the way you live or what you say to your kids or the way you act as a clinician?
I think, Chris, the first thing is that I become more aware of biases and my lack of curiosity when I think about endometriosis. So both of my own biases and biases in culture, that such a common condition isn't recognised or taken seriously. So as I speak to my family or patients or even think about my own experiences, that I am aware of the toll of people having invisible symptoms or symptoms which have been discarded by culture.
If we're doing this for endometriosis, it's very likely we're doing this for a lot of other things.
Exactly.
Chi, thank you so much for joining us again on What's Up Docs.
Chi, thank you so much. That was fascinating.
Yeah, it's a pleasure. Thank you.